Hey, Wellness Warriors, welcome to the Burnout Resolution Podcast. I'm your host, Dr. Mylaine Riobé, and today we're doing a gut check into probiotics. Are they legit or just another supplement scam? So, probiotics are a multi-billion-dollar industry, and there are all kinds of brands and different doses and different strains that people can buy. Very often, people are extremely confused about probiotics. They're often marketed as a means to improve your mood, improve your gut health, boost immunity, and many other potential solutions. And given that people are always looking for a means to feel better and to stay healthy, the vast majority of my clients at some point or another have taken probiotics. So today we're going to look into the latest research on probiotics and the microbiome so you can make an informed decision for yourself. This podcast is about self-empowerment in wellness and beating burnout. Burnout is a massive problem because so many people are just exhausted and fatigued. And it is the most common complaint that people have when they go into their doctor's office. They don't often say that they're going in because they're tired. And that's because people are normalizing their fatigue. So they go in for other reasons. They might go in for brain fog or GI symptoms. They have diarrhea or constipation, or they're having some mood issues like anxiety, depression, or having difficulty sleeping. Weight gain's a big one. They don't often tell you right off the bat that they're tired and fatigued. And very often that's because, unfortunately, they expect to be tired and fatigued, which is really kind of a sad commentary on our society today, right? We're not meant to be tired and fatigued as our default or our norm. And unfortunately, our younger generations, Gen Z, millennials, report that they are fatigued more than older generations, which is very counterintuitive. And we'll go into that today. So we're going to talk about probiotics, why they're not quite as useful as most people think. Back in 2012, the US government did a study called the Human Microbiome Project, where we looked at the genetics of the microbiome. What the microbiome is a collection of 100 to 200 trillion bacteria that are divided into about 200 different species, spelled Phyla, or kind of like what we would call clans. So clans are a group of families, and families are a group of related people. They're related by their genetics. The microbiome is very similar. There are about 7 different phyla that break up into 200 different species that break up into then up to 200 trillion individual bacteria. Now, this is a big departure from what we used to believe was the microbiome. And part of the reason that we were able to further distinguish the microbiome was due to this 2012 study. What this study revealed was mind-boggling. Before the study, we used to think that there were 3 different species of the microbiome, and that was it. We used to test for lactobacilli, bifidobacterium, and a certain strain of E. coli. These were the 3 species that we thought were part of the microbiome. Now we understand, thanks to this study, that there are over 200 different species of the microbiome, and that it wasn't quite as simple as we thought. The way that we used to test for the microbiome back then was on petri dishes. We would just culture them out and we would see how much of each of them were present. And so we made some wild assumptions based on this information. One was that if we used things like antibiotics, for example, that they would totally wipe out the microbiome. Part of that assumption was because we thought there were only 3 species. So if there are only 3 species, the risk of them being wiped out was pretty high with antibiotics. With the development of probiotics, it became almost a blanket recommendation, especially in the holistic and integrative world, to prescribe probiotics whenever someone was having antibiotic therapy. It appeared to be working on the surface for the time being. The results were mixed, but nonetheless we thought that overall probiotics were quite favorable. And so we made these blanket recommendations to people. And then those blanket recommendations expanded to not just with antibiotics use, but just for good health, and just made sense. Like, let's just keep replenishing the good bacteria with probiotics. Now, what probiotics are specifically are the actual bacteria that live in the microbiome. The idea was to put them in capsules and to swallow them. The doses would vary from a few million strains to hundreds of billions of strains per capsule or serving. Again, the assumption was let's just replace what's inevitably being destroyed by toxins and maybe poor diet and antibiotics use. Then came 2012, and the study that was done by the government at the NIH revealed just mind-blowing information. About 7 years prior to that, there was the Human Genome Project. That study looked at our genes as human beings. So outside of the microbiome, our own structural genes, like inside of our cells, how many genes were there? And we thought we were going to find millions and millions of genes in our individual cells. We were sadly disappointed when we found that there were only about 20,000 to 25,000 genes in the human cell. So if we were to compare ourselves to a common house plant, so if you have like a spider plant in your house or a rubber plant or a money tree, we have as many genes as they do. It was a massive blow to the human ego to find out that, wait, we only have the same genes as a common house plant. And then 2012 came along and we decided, hey, let's check out the bacteria that live in the human body that are thought to be part of us. Let's look at their genes and see what that shows. And we were shocked to find that there are somewhere between 4 million to upwards of 8 million genes in the bacteria that live in our bodies as part of our bodies. And that was just absolutely mind-blowing. We were, of course, shocked as the medical community. Everybody was shocked to see that the bacteria that we weren't really paying attention to. Probiotics were not a broad medical recommendation. They were only recommended by holistic and integrative doctors or savvy healthcare consumers that were reading up on their research and taking these probiotics on their own. And once the study was published, we realized the importance of the microbiome, that 8 million genes that we use for our body functions were actually contained in these bacteria. So the shock wasn't just that the bacteria that live in us have 8 million genes that code for function. It was that they code for our function, right? They weren't just coding for their own individual functions. They were so related to our own body functions. They help us regulate sleep and wake cycles. They help us even to control blood circulation. They make vitamin K, which is part of our coagulation system or our blood clotting system. They help maintain the integrity of the lining of our gut. They stabilize our immune system. They do so many things. They help regulate our moods and our metabolism. We were so shocked that this study revealed so much about the bacteria in our body that we had been taking for granted. We were pretty much indiscriminately prescribing antibiotics for common colds and anything that we thought was infectious, whether it was viral, parasitic, or yeast related. This caused us to really pause and say, we can't be indiscriminately prescribing these antibiotics and not taking care of the microbiome. What else we found out about the microbiome is it didn't just matter how many of the bacteria were there. We got a sense of how many of the good bacteria are supposed to be in the gastrointestinal system. They also exist elsewhere, right? They exist in our skin, our lungs. Anywhere where there's a mucous membrane, we will find a microbiome. They are part of the human body. We need them. They are essential to our body functions. So it wasn't just about how many of them were present. What this study revealed is it also mattered if they were functioning properly or not, if they were undergoing their own proper body functions, or their own proper functions as bacteria or not, because that dictated what genes they turned on or off and how they then regulated our body function. So if the bugs weren't happy, we weren't happy. Like that was the end result of this report. And so, of course, that caused a bit of a panic in the holistic world and even in the medical world. As a regular medical doctor, an OBGYN, there was concern in our field as well, but we didn't know what to do about it. But in the integrative world, we began to understand through the use of studies that diet was also extremely important for the microbiome. The 2012 study also showed that food mattered. How much good food that we actually feed to the microbiome dictated their function. We also found out that the microbiome is like a fingerprint. There's no one size fits all blueprint for the microbiome. So different people had different distributions of different bacteria as part of their microbiome. The one-size-fits-all concept of a probiotic started to sound really, really off. And as we started to do more studies, we began to realize that, yeah, this is not a great idea to have a one-size-fits-all probiotic approach. Even after antibiotics, even after like a cleanse or detox or a colon prep before surgery, we made the assumption that we would wipe out the microbiome. Now, with the development of some pretty sophisticated DNA testing for the microbiome, we are realizing that they're not as wiped out as we thought. They do retain quite a bit of their numbers as well as their function, despite colon cleanses and colon preps and antibiotics and toxic exposure. This fortified the idea that probiotics are really not a one-size-fits-all solution, and we need to really rethink how we're doing this. Now, that's not to say that antibiotics didn't alter the microbiome. They do. It's just that we made the assumption that it would kill off all of the good bacteria and leave them in really low counts, and that the probiotics would then replenish their counts and thereby replenish their function. But we found out through testing the microbiome that that's simply not the case. There might be a few species knocked out by an antibiotic, but the vast majority of the 200 different species would be alive and well after antibiotics use. And so putting in more bacteria as a one-size-fits-all broad approach would imbalance the microbiome in a whole other direction. So if you had, for example, species A was low after antibiotics use, but species B through Z were normal, and you put in a generic probiotic to make species A go up, what you were inadvertently doing was making species B through Z also go up. And if they were already normal, now you were inducing an overgrowth situation in the microbiome, which placed people at risk for what we call SIBO, or small intestinal bacterial overgrowth, which is a massive problem. It is essentially an epidemic, an unknown and unrecognized epidemic among the vast majority of those who live in the United States, especially. Studies are revealing that upwards of 70% of the US population has SIBO. SIBO is small intestinal bacterial overgrowth. So this is not just bad bacteria that come in through, for example, food that we might eat or beverages that we drink, things that might end up in our mouths or on our lips from our hands that we touch our mouths, but also overgrowth of the actual good bacteria that then migrate into the small intestine because they're just there in large numbers and they're out of balance. And so the studies started to reveal that we're actually placing people at risk for infections through the use of probiotics. The issue with SIBO is it doesn't announce itself like an acute infection does. If you eat some bad food and it's got salmonella on it or something like that, a bad bacteria, so to speak, you know that you have gotten salmonella gastroenteritis, right? You get nauseous, you may vomit, you have loose stools, you have abdominal cramping and pain for several days. SIBO is not like that. You may not even feel it. You may have a little bit of bloating here and there. I've even had some clients say, I have loose stools, but only during my menstrual cycle. Or I'll have clients say, I have loose stools, but maybe twice a month. Other people may have constipation. I don't move my bowels as often as I normally do. It can also induce heartburn and a little bit of nausea, but it's usually not like a food poisoning type of nausea. Most people just think things are a little off. Most people think it's the foods that they're eating, and so they start eliminating certain foods from their diet in an attempt to control those symptoms. And it's usually successful, right? If you find the offending foods and take them out of your diet, the bacteria are not as active, and so the symptoms get better. But that's also masking the fact that you have this infection and not actually treating the infection. Eventually what happens to these people is they end up with other food sensitivities later, and they have to take more and more things out of their diet. And that's because it's not the food, it's actually the fact that you have an infection that's creating the sensitivity to the food just through the inflammation and how the bacteria are eating that food and metabolizing it, and the gases and waste products that they're producing as a result of eating the food. Often people that have SIBO as a result of taking probiotics for extended periods of time don't really know that they have SIBO. So back to the microbiome, stress can also alter it based on the study of 2012. Aging over time, the microbiome shifts and changes, and that can be due to medications, dietary changes, the stress that we endure as we move through time. So the microbiome is very diverse and almost like a fingerprint. It's very unique to each individual. This is why there's no one-size-fits-all solution. As testing became clinically available and we started to test people through stool analysis to look at the actual microbiome and what it actually looks like, what we began to see is that, again, very clearly, most people don't need probiotics. And in fact, for most people, probiotics might even be harmful if they use them long term. Now, if you happen to have one or two strains that are low that you can get individual probiotics for just those two strains, then you might get away with using a probiotic. Just like everything that we think is a quick fix, the solution goes back to our lifestyle. And we learn this lesson over and over again in integrative medicine. When we want to take shortcuts for things, we always end up finding that the shortcuts are really short circuits. And that at the end of the day, everything always relies on lifestyle, how you eat, how you move, how you rest, how you detox and eliminate toxins, how you manage stress, how you breathe. All of these factors are critical for the microbiome. And so there is no quick fix for the microbiome. The short answer to the question, like, are probiotics legit or are they a scam, right? The answer is it depends. But for the vast majority of the people, it's not that it's a scam, it's that it's not necessary. If you're using things that are not necessary, that are imbalancing you in a different direction, then you're going to run into some challenges. And studies show that can happen. In addition to increasing the risk for small bowel infections such as SIBO, other long-term issues with probiotics use, based on a separate 2012 study, people that are immunocompromised or people that have critical illnesses, and also people that have what are called central venous catheters, which are bypass catheters that allow us to use medications and other things intravenously directly into the patient's body. Probiotics can actually then infect the bloodstream and become extremely dangerous. Now, those are kind of fringe situations. Most critically ill patients and don't use probiotics. Most people that have central venous catheters are not using probiotics. However, there is a risk based on studies, but many people are actually immunocompromised and don't know it. If you have SIBO, and it's not just probiotics use that increases the risk of SIBO. In my opinion, I believe that we're going to blame stress for SIBO because stress suppresses the immune system, allowing bacteria to enter. And also, as we know, based on the Human Microbiome Project, stress alters the microbiome as well, and not necessarily in a good way. When the microbiome is disturbed, your immune system is automatically disturbed because 80% of what we call our lymphocytes live with the microbiome. SIBO also creates a vicious circle where it's disturbing the microbiome because there's an infection in the small intestine that's dumping waste products and gases and acids down into the microbiome, hurting them, right? Injuring the microbiome, causing some strains to die, causing a lot of overgrowth. The microbiome is part of the immune system, so it's there to defend. And sometimes we'll see an overgrowth of the microbiome as a defense mechanism from other bacteria, such as SIBO infection, trying to invade their territory. If SIBO is doing that to the microbiome, that means it's also disturbing the immune system. The other thing that SIBO causes is malabsorption. So you're not able to absorb your food well. Scientific studies are showing that fat malabsorption and protein malabsorption is actually quite prevalent in the case of SIBO. In other words, you're not going to be able to absorb the fats and the proteins that you're consuming in your food, even if it's healthy. The bacteria that are causing the SIBO deactivate certain things that we need to actually absorb fats. They deactivate bile salts or bile acids, making it really hard for us to then absorb our fats into the body for our cells to be able to use. So we become deficient in good fats, even if we're eating enough. The same thing happens with proteins. They disturb protein digestion and absorption as well, these bacteria that cause the SIBO. And so we'll often see these types of malabsorptions, which we can test for with a stool analysis. But what the stool analysis doesn't show is the myriad of vitamin and mineral deficiencies that people with SIBO also have. So those immune cells also have to function properly. So it's not just a matter of having the immune cells present. They have to be functional. They have to actually be able to work and do the thing that we need them to do. So if you're not absorbing properly because you have SIBO from possibly taking probiotics for an extended period of time, or by any other cause, you're going to become depleted in these vitamins and minerals and proteins and fats. These are all things that the immune cells absolutely have to function properly. So just because you have enough white blood cells, your blood work says, yeah, we have normal amounts of white blood cells, doesn't mean they're functioning. And there's really nothing in our blood work that's going to show us if they're actually functioning. There are functional tests, integrative tests, if you will, or holistic tests that do test the function of the immune cells. Very often we see that those functions are low, even though their white blood cell counts or the immune cell counts in the bloodstream are normal. So these people are really quite immunocompromised. With integrative testing, we can get a sense of just how depleted the immune system is. And very often, I will have 30-something-year-olds with the immune system of an 80 or 90-year-old based on testing. For all intents and purposes, this is an immunocompromise. For those people, you don't really want to take too many probiotics for extended periods of time, and you might place yourself more at risk. It might be more of a risk than a benefit. There was a study done in 2018 that showed that people that had symptoms associated with SIBO, bloating, brain fog, abdominal discomfort, only felt better after they stopped their probiotics. And so we do have some really good, robust scientific evidence that probiotics are not the one-size-fits-all panacea that we once believed. The other fairly concerning study, also done in 2018, showed that there's actually a delay in recovery of the microbiome after taking antibiotics in people that actually take probiotics during antibiotics use. And so again, like everywhere we turn, we're finding this evidence that what we thought was a really good idea is simply just not. And so for me, I have started to, at least the last 4 years, severely curtail, severely reduce the number of clients that I recommend probiotics to. Even during antibiotics use, testing is the #1 way to know if you need probiotics. I almost never recommend probiotics anymore because when we do the microbiome testing, we see that it's not necessary and that we would actually do more harm than good with probiotics. Every once in a while, we'll see that there's a specific strain that's low. For example, Akkermansia. We can sometimes find to be quite low and not functioning well. And so you can take isolated Akkermansia, but you don't want to take a broad probiotic that also contains Akkermansia so that you're not imbalancing all the other strains that are normal. And so you want to be very strategic and almost surgical with how you're replacing the good bacteria, and always, always, always do testing first. Now, even companies that say that they're going to custom make probiotics for people, we're finding that even that doesn't work. So it sounded like a good idea when it was first conceptualized, like, oh, let's test the microbiome and just make the probiotics exactly what that person needs. The microbiome is so diverse and shifting and changing all the time. It's like a living and breathing organism. It's not a static thing. And so even that doesn't work. So again, like, what's the solution, right? Everywhere we turn with these probiotics, we don't have a solution. So if you're not tested and you don't know, the best recommendation is to not take probiotics at all. Now, what is it that you can do, right? It always boils down to lifestyle, sensible eating habits, and lifestyle management. And we can see changes in the microbiome in literally just a few days from making these lifestyle adjustments. So we have scientific evidence that lifestyle changes will help the microbiome more than probiotics. Eating the foods that help them are very beneficial. Now, the one caveat to that, again, is if you have SIBO. If you have SIBO and you take prebiotics, now you're feeding the enemy, so to speak. So you're feeding the good bacteria and the bad ones that are causing your SIBO. So in the face of SIBO, everything changes. We don't recommend probiotics or prebiotics during SIBO treatment because we don't want to feed the ones we're trying to kill. So the solution, if someone has SIBO, is to make sure we treat the SIBO, taking the pressure off the microbiome, because all that time that you have SIBO, you're disturbing the microbiome in a very negative way. They're dying off, they're overgrowing, they're malfunctioning, they're not making what we call short chain fatty acids. The most dominant fatty acid, short-chain fatty acid, being butyric acid or butyrate. Butyric acid is extremely important. It's a byproduct that the microbiome actually makes as a result of its normal function. Butyric acid is extremely important for the integrity of the lining of the gastrointestinal system. Butyric acid is also extremely important in controlling inflammation as well as metabolic functions. And so when the microbiome is not functioning well, not making enough butyric acid, we can see other conditions develop, such as leaky gut. And again, a lot of people mistake the idea that leaky gut is just this standalone issue that they need to treat, but it has to have a cause. Something is causing the leaky gut. Very often it's SIBO or SIFO, which is a fungal infection in the small intestine. And yes, you can take butyric acid, so you can take MCT oil with butyric acid. But first you want to be tested to know that you actually need that kind of support. And again, in integrative medicine, we do have testing available to tell you if the microbiome is working properly and if it's making enough of the short-chain fatty acids or butyric acid mainly. So before you load up on prebiotic foods like fibers and inulin and perhaps capsules that are prebiotic by their nature, always test first. Always get a functional stool analysis or a specific breath test to see if you have SIBO or if you need additional types of support for the microbiome. Now, if you take a prebiotic and you don't feel well, chances are you have SIBO because you're feeding the so-called bad bacteria. You're making them more active. They get to make more gases and waste products when they're more active. When they're getting fed the things that they like to eat, they're just going to party harder and make more junk, and you're just going to feel lousier. So don't push that. If you feel that, hey, I took this prebiotic and now I don't feel good, I have bloating and brain fog and I don't feel well, go get tested for SIBO. Make sure that you're tested because you don't want to, again, further imbalance your gut. Now, once you've cleared up the SIBO, or at least are in the works of clearing up the SIBO, now you want to go and look at the microbiome and see like what support do they need. And very often, again, probiotics is not the solution. And so then once you've cleared the SIBO and you're on your way to having that root cause corrected, now you want to feed the good bacteria. And you can do that with food. There are foods that are known to be prebiotic in nature. Green plantains are one, and green bananas are another. And so those you would treat as a root vegetable, for example, like a potato. So you would cook them very similarly to how you would cook a potato. So boiling them would probably be the easiest thing. Oatmeal is also considered a prebiotic, as is a white potato that is cooked but then cooled in the fridge. What the cooling process does is it changes the configuration on a molecular level of the potato, and it actually turns it into a prebiotic. So if you reheat it, it loses its prebiotic quality. So you have to let it cool down in the fridge and then eat it. The same thing for white rice. So it's cooked white rice, but then you cool it down in the fridge and then you eat it cold. So sushi rice, for example, is actually prebiotic. And of course, you can buy prebiotics in the store. Most prebiotics come with some probiotics mixed in. When we say that probiotics are not useful and they're not a one-size-fits-all, what we're talking about is the store-bought in the capsules, in these powder packets that have like large numbers of bacteria in them. For example, in the billions. So we can buy capsules of 5, 10, 100, 200 billion colonies of bacteria and literally take them as pills or powders. Those are the probiotics I'm talking about that are harmful. There are fermented foods that have probiotics in them. We might find 1 million up to 5 million bacteria in those types of foods. I'm talking about yogurt, kimchi, any fermented food at all. Kombucha is also a fermented product. The numbers of bacteria that we'll find in actual food is not enough to cause the harm that we're seeing in the studies about probiotics. And so having yogurt, again, dairy might irritate some people, especially if they have SIBO. SIBO bacteria love dairy. And so if you're eating dairy and you're told perhaps that you're lactose intolerant or you don't feel well after the dairy, that could be a clue that you actually have SIBO. So you don't want to like force yourself to have dairy yogurt. You can have alternative yogurts. So again, every time we think we found, this one size fits all solution to our problems, we get smacked down and told that no, you can't cheat. You have to go about it through lifestyle changes. So there's been some controversy about, well, what diet would be best for the microbiome? And so the vegan diet comes up as a potential solution because we know that it's anti-inflammatory and that it helps reduce the risk of cardiovascular disease and so reduce the risk of cancer. So it makes sense, like, hey, let's try a vegan diet. So it turns out it's got its pluses and its minuses, right? So a vegan diet is very often very carb heavy. The bacteria that actually cause SIBO love certain carbs. They also like some proteins and fats too, but carbs are their main source of fuel. They're not necessarily unhealthy carbs that they are fueled by. So SIBO bacteria love broccoli. They love cruciferous vegetables in general. They love, again, dairy, things that vegans tend to eat in large numbers. This is part of the reason the vegan diet can kind of backfire on people if they're not careful. The other thing is if you do a vegan diet and you decide, I'm just going to eliminate the foods that the bacteria would eat and just eat the ones they don't eat, the vegan diet is already so restrictive, and people that don't eat a very balanced vegan diet can have quite a few nutrient deficiencies. So to then further restrict your diet with what we call a FODMAP diet would restrict the vegan diet even more. And then again, this is one of the drawbacks where we see it actually backfires and people actually get sick, not better. Now, there are some positive sides of the vegan diet. We do see some positive changes in the microbiome. However, if again you have SIBO and you're feeding those bacteria, it's going to backfire and we're going to see negative changes in the microbiome. So this is part of why the vegan diet is so controversial in terms of the benefits to the microbiome. So always, if you're having any symptoms of SIBO at all, even if it's mild bloating, that's enough to be suspicious that you have SIBO. Any nausea, any heartburn, any loose stools at all, no matter how infrequent they may be, any constipation at all. And I find that many people don't really know what's normal. How many bowel movements am I supposed to have in a day? Like, what's normal? 2 to 3 well-formed bowel movements a day is considered normal. So feeding the microbiome the good, proper, healthy foods that they actually like to eat and that they thrive off of will help them not just regain their balance within themselves or amongst themselves, it will also help them increase their functions, and they will then function better. And what that means is you'll have 4 to 8 million genes working in your favor instead of against you. So in summary, probiotics are not really like the villain, but they're also not the hero. And so you want to be sure that you know whether or not you're going to benefit or potentially be harmed by probiotics. And what we're finding is that the risk of harm actually outweighs the benefits in the vast majority of cases. The safest thing to do is to be tested. Also, make sure you don't have SIBO. That's extremely important. I can't emphasize that enough. Unfortunately, SIBO has not been well recognized by our mainstream medical model. And so it was only in January of 2024 that our mainstream medical model admitted that SIBO actually is a legitimate medical condition. And so it hasn't been well studied yet. And most medical doctors who have a traditional medical education are still not familiar with SIBO, and they're not familiar with how to test for it or treat it. And so your best bet is to see an integrative or functional medical doctor to make sure that you don't have SIBO. If you want to try prebiotics, you can, especially if you're taking antibiotics for any particular reason. Remember, do not use probiotics with antibiotics. It's just not recommended anymore. But you can support yourself with prebiotic food. The list of the 5 foods that we mentioned: green plantains, green bananas, oatmeal, inulin is a prebiotic, white potatoes that are cooked and then cooled, and then white rice that's cooked and then cooled. Those are all prebiotics you can incorporate into your diet as you're taking your antibiotic therapy that will best support the microbiome. Again, you can buy prebiotics in the store, but whole food is always best. So you can eat one of each of the 6 that I told you about once a day while you're taking antibiotics, and then for a few more weeks afterwards, just to make sure that you're properly feeding the good bacteria. And again, if any of those foods bother you in any way, big sign that you have SIBO. Make sure that you get that tested. So the bottom line, what's the takeaway for today? Lifestyle. Making sure you're eating good, healthy, clean food. You're not dumping too many toxins into your gut by eating pesticide-laden food, processed foods. Making sure that you're incorporating some prebiotic foods and some good fermented foods into your diet. Making sure that you get enough sleep and that stress isn't impacting you significantly. All these things will alter your microbiome. And of course, always you can be tested so that there's no mystery. You're not guessing, right? So that you know exactly what it is that you need. You'll know what condition the microbiome is in terms of their numbers, their functions. You'll know if there's infection in your gut or not. You'll know if you're absorbing your nutrients properly or not. And that will allow your functional physician to then come up with a treatment plan so that you are safely and effectively rebalancing your gut in the way that suits you and your specific needs. Also, making sure that the integrity of the lining of the gut is intact is really important. So again, you can be tested for leaky gut, but remember, if leaky gut is the diagnosis, it's the result of something else. So make sure that you are tested for other things that can lead to the leaky gut. Because if all you do is do a leaky gut protocol and you take the supplements that are supposed to rebuild the lining of your gut, but you haven't treated the root cause of it, it's just going to come back. So testing is always my number one recommendation to make sure that you know exactly what's step one, what's step two, what's step three, all the way through. So that at the end of the day, you have the most optimal functioning gastrointestinal system you can have, because that is the key, most important system in your body. So while we say, no, it's the heart and lungs are so essential, like, what are you talking about the gastrointestinal system for? I say, yeah, the heart and the lungs are for immediate survival. If your heart stops beating, you're done. If you stop breathing, you're done. But what feeds those systems to keep them going is the gastrointestinal system, right? So if the GI system's not working, this is why we see the connection to heart attacks, cardiovascular diseases with conditions such as SIBO that dysregulate the microbiome and the immune system. And so again, the gastrointestinal system is kind of like the tortoise, right? And the heart and lungs are the hare, right? So they're the ones that get all the attention. They're the ones that need to be, immediately taken care of at all times. And then the tortoise is just in the back, just slow and steady, but the tortoise always wins the race somehow, right? Because at the end of the day, if you don't have your gastrointestinal system optimal, your heart and lungs are going to fail, right? That's just the bottom line. And so I hope you found today's podcast to be useful. It's a lot of cutting edge information that is not readily available in the medical community. You don't learn these things at the doctor's office, unfortunately. And so I do hope that today's podcast has been helpful to you and that you have actionable steps that you can take starting right now to get your gut health optimized. So if you enjoyed today's podcast and got value from it, please like, share, and subscribe to our channel. We are now broadcasting on all podcast channels, so you can watch us on Apple Podcasts, Spotify, anywhere that you would listen, iHeart. New episodes are Wednesdays at 12 noon Eastern Time. If you're interested in our burnout program and want to take our burnout assessment, please visit our website, awakenedwellnessnow.com. Take our new burnout assessment. If you'd like to learn about our corporate burnout programs, please connect with me on LinkedIn, send me a message. I'll be happy to share our corporate burnout assessment with you and create a personalized report for your organization to help your team members start beating burnout for good. Thanks for listening to the Burnout Resolution Podcast. I'm your host, Dr. Mylaine Riobé. And until next time, many, many blessings.